The Food Link program involves volunteers going to food bank at Yarraville and collecting bulk produce and making the food hampers. If any of our clients were to see a social worker or an OT or speech pathologist and they represented themselves as somebody that was not doing well in terms of putting food on the table, then our workers, our staff would be able to give them that option of a food hamper to help them out.
We work with clients who are at risk of or experiencing homelessness, so often they need some support around getting their basic needs met, and one of those things is food that they really struggle with. It's definitely benefited us and our clients because it's a lot easier for them to access the food through us if they're seeing us anyway. They don't have to go out and about trying to source it from all different emergency relief programs if they know we're doing a home visit.
We work largely with pregnant women and new mums and their families. Quite a lot of them too are refugees and asylum seekers, so cases do without benefits. So their income is very scarce, so obtaining enough food to put a plate on the table of an evening can be really stressful.
Yeah, I think DPV Health are doing a wonderful job in distributing food donations to those who really need them.
The GLAD program is an amazing kind of program which demonstrates the innovative nature of physiotherapy in a number of different ways.
According to the best practice, exercises, education and lifestyle modification, if you are overweight, should be the first line of treatment if someone is suffering from hip or knee osteoarthritis. This program is holistic. In Denmark, they have studied this program on over more than 20,000 clients and they have found some good results. Hip and knee osteoarthritis is some of the leading reasons for pain and disability around the world.
I had a torn meniscus. I felt my knee was very unstable before, and from having, doing the exercise has definitely strengthened my knee. So no, I felt much better with all the exercises.
This program started in January 2019, and it was, I thought about it because someone donated the coffee machine, and I feel that the clients will benefit to build their confidence to want to go out there to find a job maybe in this field. I have seen that progression in them, and now I think they are ready to be out there. I feel that they can do it.
Hi, I'm Ruth. I'm an adult speech pathologist, and essentially what that means is I see anyone with communication or swallowing difficulties. We've excitingly just started the adult speech pathology service here at Hume. Historically, Hume hasn't had adult speech. Both Whittlesea and Hume have been advocating for more funding, and just before the merge, Whittlesea got some more funding, which has actually meant that we can set up a service in Hume for the very first time. And it's really fantastic that we now have adult services across both Hume and Whittlesea, and that we can work together as a united team.
So Boyd was diagnosed with autism. So before that, we really weren't accessing any services at all. Then we got introduced to our, I suppose you'd say, key worker, and everything kind of changed from there, really. Here we are 12 months later, having accessed, I suppose, a huge range of services. You sometimes think you're a bit of a number, because you just, it feels like that sometimes, and but you guys haven't made us feel like that at all.
One of my favourite parts about my job is the kindergarten visits. We put together a project where we would go and perform some visits to kindergartens. So it began in 2014, and we have in this time seen over 2,000 children. Since beginning last year alone, I think we saw somewhere between 600 and 700 children. And we worked out that about 25% of those were in need of further referral or assessment, whether or not it was with podiatry, physio, speech or OT.
This year more kinders are coming on board and getting in contact with us to join the program, so I think we've got another 3 or 4 new kinders come on board this year with the program.